Hi, my name is Kimrin Pannu. I'm a senior analyst at Patari Evidence, and I'm going to run you through our ISPOR poster, which looks at the topic of comparing the differences in mental health care coverage between US public and private healthcare insurers. The US healthcare system operates under a mixed payer model combining public and private health insurance plans. Public health insurance, such as that provided by Centers of Medicare and Medicaid Services, also known as CMS, coexists alongside private insurance options. This dual system can be complex and challenging for US citizens to navigate, and our poster highlights the similarities and differences between public and private payer policies, their coverage decisions, and the clinical guidelines related to mental health based on what is available in the public domain. The inspiration of this poster stemmed from a previous project where I explored the differences in healthcare coverage within the US, focusing on a therapy area relevant to one of our clients' products. I was surprised by the significant variation in healthcare policies, and this motivated me to investigate another therapy area for this poster. I thought it would be interesting to discover what types of conditions are covered by health insurers in regards to mental health, and what treatments in terms of therapy and pharmacological options are offered. Now just to walk through the poster. So, mental health services are a clear priority in the US healthcare system, and this is demonstrated by the fact that all individual and family plans sold through the health insurance marketplace are mandated by the Affordable Care Act to include mental health services. However, since the US health system is complex, consisting of both private and public health insurers, as demonstrated in Figure 1, coverage varies between insurers. The findings from our research demonstrate that in terms of CMS, which is the main public payer we focused on within our research, comprehensive details were available about its mental health provision, and they had published a specific behavioural health strategy document aimed at improving access and quality of mental health services to CMS beneficiaries and its consumers. Within CMS, the largest national payers for behavioural health services were Medicaid and CHIP. However, interestingly, the specific details of their services were not publicly available. In contrast, Medicare provides several documents detailing the mental health services covered under its various plans, with Medicare Part B offering the most extensive services. Table 1 lists the Medicare plans and examples of the conditions and services covered based on what is available in the public domain. Now moving on to the private insurers. In 2024, the top 3 private health insurers were United Health Group, Allegiance Health and Kaiser Permanente, as you can see in Figure 2. Which also lists the top 10 private insurers by market share. Our poster focused on these 3 top private insurers, and as expected, due to the Affordable Health Care Act, all 3 private insurers provide mental health coverage. However, the details in the public domain vary between the insurers. In addition to this, the amount of coverage received is dependent on the type of insurance plan held within each company, as demonstrated within Table 2. Out of all the private insurers, Allegiance Health was the most transparent regarding what conditions and services they cover, as well as listing those that they do not. As seen in Figure 3, the range of mental health disorders covered by CMS was much more limited compared to the private insurers, and out of the private insurers, Allegiance Health Group and Kaiser Permanente covered the most conditions. However, it's important to note that this is based on publicly available information, and insurers may cover additional mental health disorders that are not listed. For specific coverage details, individuals are advised to log into their insurance portal, as coverage can vary depending on their plan. So based on this, we concluded that mental health care coverage varies between CMS and private insurers, which may lead to inconsistencies in access for patients. Also, the limited transparency due to what is and what is not available in the public domain may result in challenges in patients understanding coverage details. Overall, this highlights the need for greater transparency and consistency in mental health care coverage across the US healthcare system. Our findings enhance the current knowledge in this field by gathering all the relevant publicly available information regarding mental health policies in the US into a single document. This research helps demonstrate the differences in transparency and coverage between public and private payers, and the gaps in publicly available information that may be preventing patients from making informed decisions regarding their mental health care coverage options. But also, this learning applies more widely across other therapy areas, as these findings are likely to extend to other therapy areas due to the pluralistic nature of the US healthcare system. If you'd like to learn more about this topic, please come and visit us at the Patari Evidence stand to read our poster and learn more.